My name's Lisa, I work within Specialist Services and I'm Social Care Lead. What's a restricted patient? A restricted patient refers to somebody that's been detained under Part 3 of the Mental Health Act. That's usually because they've been detained as a means, a way of protecting the public. People can be detained under several different sections. The main one is section 3741, which means somebody will be detained in a secure hospital. The other sections can relate to people that have been transferred from prison. What the restriction means is that the Ministry of Justice have the authority over somebody's leave and discharge from hospital. The doctor cannot make that decision. A social supervisor refers to the professional that's involved in providing reports to the Ministry of Justice following somebody's discharge from hospital. A person is generally discharged from hospital subject to section 3741 of the Mental Health Act, and following discharge they will be conditionally discharged. There are two significant roles in this process, the social supervisor being one of them. What that means is a social supervisor has to report on the person's care in the community and their rehabilitation and risk to the public on a regular basis. Reports are statutory and they have to be completed initially within 28 days of discharge and then quarterly thereafter. These reports have to also be shared with the Responsible Clinician. The social supervisor often visits the person once a week initially, and then that would maybe decrease when the person becomes more settled in the community. The social supervisor's role is to provide the statutory reporting to the Ministry of Justice on the person's continuing care in the community relating to the conditions. So it might be about allowing access to somebody in the community, it might be reporting on their mental state or their risk to the public. It's key that the social supervisor has established a good rapport with the patient, ensuring they're including sort of social inclusion within their work rather than it just being seen as a policing role. Any changes in circumstances needs to be reported to the Ministry of Justice on a regular basis, and at the Ministry of Justice is a caseworker that you can liaise with. The social supervisor also has the power to seek approval from the Ministry of Justice to recall a patient from the community if the risk is seen as significant or the person is seen as a risk to the public. The difference between a care coordinator and a social supervisor is that a care coordinator often works with mental health services in the community, dealing with people with mental health problems with complex needs. Generally the person there will have a care coordinator who's responsible for coordinating the person's care, providing a care plan, crisis contingency plan, and supporting the individual in the community and reviewing and monitoring that care plan. The difference with a social supervisor is it's a statutory role that has to report to the Ministry of Justice on a regular basis. A person can be discharged from restrictions under the Mental Health Act via a tribunal for mental health or via the Ministry of Justice. This is known as an absolute discharge. A person can appeal against restrictions under the Mental Health Act. This can be done in two ways. One way, if you're in hospital, you can appeal via a first-tier tribunal mental health for a conditional discharge or an absolute discharge. In the community, if you're subject to a conditional discharge with oversight from a social supervisor, you can apply again to a first-tier tribunal for mental health for an absolute discharge. These have particular timescales that are different from the civil sections under the Mental Health Act. A case example of social supervision in practice relates to a female service user who's currently managed within our team by a social supervisor. The case history was that she became mentally unwell in the community and unfortunately committed a serious offence against a relative. She was subsequently detained under section 3741 of the Mental Health Act and received treatment in care within secure care for a significant period of time. She was later discharged by a first-tier tribunal mental health under a conditional discharge and was discharged into the community into some supported home living arrangements. During that time, she was allocated a social supervisor who provided reports to the Ministry of Justice on a regular basis regarding her initial care, treatment and her risk that she presented with. The risk was deemed as quite low at that time, and the service user remained to be compliant with the care plan. Over the coming weeks and months, the input that was offered was significantly reduced, so she's now seen on a monthly basis. The Social Supervisor continues to report to the Ministry of Justice every quarter.